What is up, you guys? Today we're going to do something absolutely insane. I was scrolling through the internet the other day, and I saw some of the craziest things people believe about their teeth. We're talking myths so wild I had to make a video about them. We're going to debunk the 4 biggest dental myths I see everywhere. And to make it even crazier, under 7 minutes. Can we do it? I don't know. But we're about to find out. This isn't just fun facts. It's about your health. I reached out to actual dentists to get the real facts. We'll separate myths from reality. Some will blow your mind. Before we jump in, smash that subscribe button. Alright, first up on our myth-busting list is a big one. Maybe the biggest one I see. The myth is that whitening your teeth is basically like taking sandpaper to them and will completely ruin their enamel forever. So many people are terrified to even try whitening because they think their teeth will become weak, brittle, and fall apart. They see pictures of super bright white smiles and immediately think, that can't be healthy. It stops people from getting a smile they could be more confident with. But here's the reality. When done correctly, teeth whitening is one of the safest cosmetic dental procedures you can do. The keywords there are, when done correctly. The active ingredients in most dentist-approved whitening products are designed to work on the stains within your tooth, not on the enamel itself. Hydrogen peroxide carbamide peroxide. They penetrate the tooth and break down the discolored molecules that make your teeth look yellow. It's a chemical reaction, not a physical grinding away of your tooth surface. So where does the whole whitening damages teeth idea come from? It usually comes from sensitivity. A lot of people experience some temporary tooth sensitivity after a whitening treatment, and they mistake that feeling for damage. They think, oh no, it hurts. I must be destroying my teeth. That sensitivity is often due to the whitening agent temporarily dehydrating the tooth and reaching the nerve layer, the dentin. Okay, get ready for this next one because it sounds like something out of a horror movie. I have genuinely seen people ask this online with total seriousness. The myth is, if you have an upper tooth removed, especially one of the canine's eye teeth, your eye on that same side will literally shrink or sink back into your head. People are actually afraid to get a necessary tooth extraction because they're worried it will mess up their face and make their eye look smaller. Let's get straight to the science. Your eye sits inside a bony socket called the orbit. The orbit is a solid protective structure made of several bones. It is completely separate from your jawbone and from your teeth. The floor of the orbit separates the eye socket from the sinus above your upper teeth. Your tooth roots do not go anywhere near your eyeball. They are in a completely different house, so to speak. The belief likely comes from a misunderstanding of facial anatomy. Canine teeth, the pointy ones, have the longest roots of any teeth in your mouth. They sit under the cheekbone that supports the skin below your eye. When a tooth is removed, the alveolar bone that held it no longer has a job. Alright, let's talk about a trend that's been all over social media. Charcoal toothpaste. You've seen the pictures and videos, right? People with their mouths full of black paste, smiling to show off supposedly whiter teeth. The marketing is brilliant. It looks cool. It's natural. It promises amazing whitening results. The myth. This black powder is a secret, super effective whitening hack. But here's the reality. And the Instagram ads won't tell you. Activated charcoal is extremely abrasive. Think of it like a very, very fine sandpaper. Brushing with it is scrubbing away surface stains on your enamel. Stains from coffee, tea, red wine. Short term. Teeth may look brighter because you scraped off the top layer. Problem. That scraping can remove enamel. Charcoal can start to scrub away your actual tooth enamel. Enamel, shocker, hard, protective outer layer. Once it's gone, it does not grow back. Ever. Regular charcoal use risks permanently thinning enamel. What's under the white enamel? A yellowish layer called dentin. Irony. Trying to whiten can make teeth look more yellow long term. Okay, final myth. And this one is super important because it's a piece of advice that seems logical but is completely wrong. The myth is, If your gums are bleeding when you brush or floss, it means you're being too aggressive, and you should stop brushing that area to let it heal. It makes sense on the surface, right? If any other part of your body was bleeding, your first instinct would be to leave it alone. So, people notice a little pink in the sink and immediately back off from that spot, thinking they're doing the right thing. But in reality, you should be doing the exact opposite. Bleeding gums are rarely a sign that you're brushing too hard. Instead, in the vast majority of cases, they are the #1 sign of a condition called gingivitis. Gingivitis is the earliest stage of gum disease, and it's incredibly common. It's essentially an inflammation of the gums caused by a buildup of plaque along your gum line. Plaque is that sticky, invisible film of bacteria that's always forming on your teeth. Here's what happens. When you don't effectively remove that plaque by brushing and flossing, the bacteria in it release toxins that irritate your gum tissue. This irritation triggers an inflammatory response from your body. Your body sends more blood to the area to try and fight off the infection, which makes the gums swollen. And that is it. 4 massive dental myths, completely debunked. Whitening doesn't destroy your teeth. Pulling a tooth won't shrink your eye. Charcoal is more harm than good. Brush your gums if they bleed. I really hope this helps you make better, healthier decisions. The internet can be a crazy place full of misinformation. My goal is to cut through the noise and give you the real facts. Don't let these myths scare you or lead you down the wrong path. I had a ton of fun making this video. If you had fun and learned something, you know what to do. Please hit subscribe. We're building an informed, awesome community. Click the notification bell so you don't miss the next crazy video. Question of the day: comment which myth you used to believe. Be honest, I'm curious. Thank you so much for watching.